Now, the number of people living with dementia in the UK is forecast to rise by 75% by 2050 to almost 1.6 million. The Global Burden of Disease study, which is published in The Lancet, says cases worldwide will triple unless key risk factors are addressed. Now, these risk factors include smoking, obesity, high blood sugar and low education. And I'm joined now by the Head of Research at the Alzheimer Society, Richard Oakley. Very good to see you this evening. Really worrying, these statistics, because of course they mean much more heartache for so many people who are affected by it.
Yeah, that's absolutely right. I mean, these figures confirm, I think, what we've expected and kind of knew, but haven't had the data really to show, that the number of people affected by dementia is growing. And this paper highlights the biggest risk factors are growing population and age. And unless we look at some of the modifiable risk factors, like you mentioned there with obesity and the high blood sugar, unless we take action, this is what will happen. But I think the underlying message is an empowering one. It's a positive one. This is what is forecast to happen. But we have done so much research, and the Alzheimer Society has been leading on this, and we know there are things that everyone can do to reduce their risk. And I think this shows what happens if we don't do that, but we absolutely can.
And you outlined some of the things there that are causing this increase. But aren't we doing better? Aren't we all eating more healthily? Aren't we smoking less?
Yeah, we are. And I think that this data obviously looks at many countries, and it's a global reflection. And it does look at smoking and obesity. And I think smoking is going down, but obesity, I think we can, I'm not so sure about. But also there's high blood sugar and education levels. But we know there are actually about 12 modifiable risk factors, and this paper obviously only looks at some of those. And I think really one of the messages that has got through to the public is about what's good for your heart. And we know smoking and taking regular exercise and drinking in moderation are good, but they are good for your brain too. And we really need that message to get through to individuals, to empower them to make a difference, but also to policymakers, so that we can create an environment where people are able to live those healthier lives and understand and know what is good for them.
Yeah, it's quite a hard message to get across, isn't it? Because we all know that obesity can affect you physically in many, many different ways, but we don't necessarily associate obesity with our minds, with our brains.
No, that's absolutely right. I mean, we do link obesity to many different diseases, but not to our brain, the most important organ in our body, but it's absolutely correct. And I think that studies like this are so important for highlighting the fact that there are things we can do. And the authors call for slightly more aggressive action in prevention. We do know, we have seen reduction in prevalence rates in the UK where people have been taking positive action, but we need to see more. But I think over the last number of years, we've done so much research. We understand more about dementia than we ever have. And research will beat dementia. Prevention's a vital part of that. And the Alzheimer Society, we're very dependent on the public's generosity and donations, and we need to make sure COVID doesn't stall the progress we've been made. And we also call on the government to kind of realise its promise to double spending in dementia research, the dementia moonshot so-called, because we are at a pivotal point. This data shows what could happen unless we take action. So we need to make sure everyone realises that and knows they can all make an individual difference to their risk of dementia.
How are we doing in finding a cure for dementia?
So there hasn't been a new treatment in the UK for 20 years now, which is a long time, but we do have over 120 clinical trials going on globally. And it's probably never been as good as it has been. There are challenges. It is a very difficult disease. Dementia is an umbrella term for at least 130 different diseases that cause the symptoms that we describe as dementia. But we've never been more positive. And I think we are not far away. We can see light at the end of the tunnel where we are developing really exciting treatments that we hope are going to be available shortly. And we just can't let the pandemic and the reduction in spending either through charities like the Alzheimer Society or government stall the momentum, because we really are at the cusp of developing those early treatments which will slow down the progression of the disease.
And of course, you've got a personal experience of dementia. I know you've talked about it publicly before, but you know just how key it is to try and make those changes.
Yeah, absolutely. I mean, I think we all want to see that treatment. I think research will beat dementia. It has beaten many other diseases, and it will beat dementia. We need time and we need money and investment to develop those treatments. But there are many other aspects. The prevention aspect mentioned in this paper, where we can empower people to to live maybe slightly healthier lives, smoke less, drink less, take a bit more exercise that can affect their individual risk. We also know there's a lot we need to do in the social care space and the care and the quality of life that we provide people who have been affected by dementia, and the support we give to the family who often take up a lot of the caring responsibility. So there's a lot we can do right now to improve the quality of people's lives. There's a lot we can do to help prevent more cases. And of course, we at the Alzheimer Society and others are working really hard on those treatments.
Yeah, and finally, you've touched on this already, but we know people do give very generously to charities such as yours. But do you feel the government's doing enough when it comes to that research?
Well, the government has played a big role in the last decade. The Dementia Research Institute is a fantastic institute based in the UK, really bringing in some of the best minds into dementia into the United Kingdom to do this research, which is fantastic. But they did make a commitment, a promise to doubling dementia research, which is fantastic and can make the UK really a global superpower in dementia research. And we're still waiting for that to be realised. So, of course, I absolutely call for that to be realised sooner rather than later.
Yeah, global superpower in research would be great, wouldn't it? All right, Dr. Richard Oakley, thank you very much indeed for your time.